want to welcome you to the office and also tell you that we look forward to seeing you for your upcoming visit. And I want to also share with you ways that you can get the most value out of your experience here and how to be the most prepared. But before I do that, I want to tell you a bit about who we are and how we approach knee pain and why we do what we do. You know, I've been in practice for 18 years, and the majority of the time I see patients with chronic degenerative arthritis in their knees going through the same cycle. Medications, and when that doesn't work, come back, steroid injections, and just continuing to do steroid injections as long as they're working until the knee is so degenerated, and now it is time to replace it. And unfortunately, that was most of the resources that patients had available to them to do for their knee pain. But we take a different approach. We're about helping our patients avoid surgery. You don't want to have surgery. You want to keep your knees as long as possible. Knee pain is one of the #1 causes of disability and low quality of life. So we put together a protocol that actually helps to regenerate and heal the knee from within, using specific nutrition, using low-level light therapy that actually helps regenerate the cells, combining that with modalities like chiropractic and physical therapy to help strengthen the muscles around the knee so then it lasts. And we have a multidisciplinary team because we want to work together, the best of chiropractic and physical therapy and medicine, in order to actually heal your body from the inside out and restore your quality of life and help you avoid surgery. Follow me. I want to take you on a quick tour of our clinic and tell you more about the Restore Way. And then also I'll share with you a story from a patient that was in your shoes not long ago. The Restore Way in healing osteoarthritis and degenerative joint disease naturally. We have our medical team that actually uses the best that medicine has to offer with advanced joint injections that can actually lubricate the joint, and also trigger point therapy for the knots that develop in the muscles around the knee from long-term damage. So an essential component in treating degenerative joints in the knees, bone-on-bone knee, is actually using knee decompression. We are the only office in the metro that has this machine, but it's very gentle. The patient sits, and this actually opens up the knee joint and allows for nutrients and oxygen to get pulled into the space to help heal the cartilage. With degenerative knee, osteoarthritis, bone-on-bone, we can repair and we can regenerate and heal the inside of the knee, but we need to make it last. We still live life, and we want to make sure we use board-certified, state-of-the-art physical therapy working one-on-one with you to repair your gait and mobility so it lasts as long as possible. When you come and see us, you're going to meet with our case manager, a valued member of our team whose job is to make sure our patients get the most of their experience with us and communicate with the doctors. And here you'll meet and we'll get a detailed history. We want to learn the most about you so we know the best way to care for you, your values, your goals, what can be the one thing that we can do to help change your quality of life. With the Restore Way, we want to make sure that yours is a case that we can help. So we do advanced diagnostic testing. When we look at your joints, we'll be doing an orthopedic testing, an exam. We'll take digital x-rays so we can actually see the health of the joint. If you have recent images or MRIs, please bring them with you. We want to look at those as well, because I promise we only accept cases that we can help, and we'll be honest with you if we can get you to your goal, or we will get you to the provider that can do so. And like I said, stay tuned for a testimonial from a patient who was in your shoes not long ago.
So we have Wes here at Restore Muscle and Joint, and he just finished our knee program actually. Wes, can you tell us a little bit more about what you were feeling before you came into Restore Muscle and Joint?
Yeah, I'm officially retired. I was 74 last Thursday. But I've got rental houses, and my wife has rental houses she had before we got married 20 years ago. And then I also do some engineering work on a contract basis, which in some cases, like looking at apartment buildings and stuff, requires me to do a lot of stair climbing. And I've got to the point on both of those where, if I wanted to do something you normally would squat down to do, like to fix some plumbing underneath the kitchen sink or a bathroom lavatory, I couldn't kneel down. I just had to get down on the floor and lay on the floor, regardless of how clean it was or not. And I then struggled to get back up because I had to basically get my elbow up on top of the counter so I could pull myself up, in addition to what I could do with my legs. My right knee was significantly worse than my left knee, and as far as the stair climbing, I had to turn down jobs that involved like 500 apartments. I had to look at 52 of them, and some of these burgers are 3 stories tall, and it seems like half those I had to look at were on the top floor. And so when you had multiple buildings, you had to go up, I jumped at the chance to get one that had elevators in it, but anyhow, that was my limitations. Like I said, I had to turn down, I don't know, over a year's period, I probably had to turn down $12,000–15,000 worth of work because I just couldn't climb the stairs.
Yeah, and I remember you telling me that when you first came in. And can you tell us a little bit about what your treatment has been like and what you've experienced so far?
Yeah, most of it has been regular physical therapy. They do have a machine here that they strap your leg into, and it kind of looks like something they would do for somebody that skied a slope they shouldn't have or something. But anyhow, it puts mild tension on the knee and massages it back and forth with, I believe it's up to 15 pounds of pressure. And the idea is to move that joint around internally so that it can be naturally regenerated from fluids within the body and the movement. Actually, a knee surgeon had looked at my knees, told me I was a candidate, and all I could do is postpone it and try to, get some relief. My right knee, as far as how much it would bend, I was only at 90 degrees, and the doctor told me that the cartilage in my right knee that had been worn away was accumulating at the back of the knee, and no amount of therapy was going to get me beyond 90 degrees in that knee. As it turned out, with the very specific, very personalized program that they have here, I just had my final measurement, and my right knee is now at 130 degrees.
Oh my gosh, that's so awesome.
Yeah. Now, unfortunately, my left knee, which wasn't so bad, I've only gotten it to 117 from 93, I think it was. So it was a little better to start, but the right one is feeling so much better. I almost think my left one's hurting more now because my right one's not hurting as much. But I've done the same thing. I mean, everything was do this knee, then do this knee, or in a squat or something like that. Why did both knees at the same time, of course.
Is there anything that you could say that you can do now that you hadn't when you came in?
Up or down stairs, I pretty much had to follow the old adage, up to heaven, use the good knee, down to hell, use the bad knee. So I was stutter stepping up and down stairs. And I got some really strange looks from the people when I do these apartment buildings because I was always lagging behind, so the old fat guy was hanging back, but I didn't before, but it was because my knees had gotten so bad. But now I can go up and down the stairs without, stepping up. I just go step after step, up and down, as long as there's a handrail. I'm still not confident. When I come out my front door, I got down onto the concrete stoop and then 2 down to the sidewalk, and there's no handrail. And I either got to put a handrail up or just build up my confidence enough, because I still don't try to step down, putting stress on my right knee. But otherwise, while I can go up and down the stairs, my legs still get tired. I still have some discomfort. Sometimes I rub some cooling cream or something on my knees at night. I put a pedometer thing on my phone so that I can track how far I walk. It's a rough estimate. But it used to be, if I went over 3/4 of a mile in a day, I had to get in the shower and turn the water on cold. It comes from a reservoir here, so it's pretty cold. And run it on my knees to get any relief. And I haven't done that in a couple months.
Awesome, yeah.
Cold water. But now pretty much as soon as I get off my legs, I feel better. So during the day, if I can sit down for just a couple minutes, why, you know, it relaxes. I don't, maybe a mild ache, you know, or something. But last week, things we were doing, and all, some family in the hospital and going to see them and going by their house and all that, why, 4 of the 5 days last week, why I walked over 2 miles. And I was
That's
not,
awesome.
yeah, I was not, you know, completely out of it or anything. And I couldn't have done that, you know, before. That's
Mm-hmm.
just, I mean, I can say that with every confidence. It's just the limitations. But
Yeah.
I've been doing some things on the rental houses we have. I've got a guy that works for me, but just some things I really can't see paying him $35 to go over and check to see if the circuit breaker had blown or something like that. So I'm doing much more of my own work that way. And then of course, well, tomorrow I got to go to Wichita and look at a building down there, which I had no reservations about doing. They also wanted me to go here in the neighboring town of Lenexa, but it was a 511 unit apartment building, so I said I'd have to do 52 of them, 3 stories. So I told them I'm not ready for that yet.
Mm-hmm.
Hopefully, with the home program they're giving to me, why you know, I can move forward on that. And truthfully, if I never do another 500 unit apartment complex, I'll be tickled to death anyhow. So,
Yeah.
yeah.
All right. Well, we are so happy for you and your success. And yeah, we loved having you here.
Okay, well, thank you very much.
Thank
The
you.
staff is great, and you know, just you know, you take it at your own pace. I'm sorry. Take it at your own pace, but you know, if you start falling too far behind, why, they're not afraid to tell you need to buck up. So,
All righty. Thanks, Wes.
sure thing.